The team looking into COVID-19 treatments and vaccines at the Nottingham Biomedical Research Centre has been working around the clock to try and help to provide effective treatments as quickly as possible. But the centre's director has said a working vaccine for the country is still half a year away at best.
What really matters is whether or not, if you have that vaccine, it prevents you from getting COVID-19.
Yeah.
Now, one would assume that if you have a good antibody response to the vaccine, it will help protect you, but that has to be proven because there are examples where you see an immune response to a vaccine, but it doesn't actually protect you from disease. So that's the absolutely key bit. And assuming one can demonstrate that, then you have to scale up production of a vaccine and deliver it to obviously large numbers of the population for it to be effective in preventing spread. So that, in general, is a process which is highly unlikely to get finished in less than 6 to 9 months, I would have thought.
Commenting on the national picture, Professor Hall says lockdown measures have been effective on the whole, and that areas which have seen spikes have done so because they are more difficult to manage.
What we're seeing at the moment is a slow, steady trickle of cases locally, and obviously there are some parts of the country, Leicester, Greater Manchester, most recently Aberdeen, where there have been spikes of cases. So I think that tells us two things. The first is that the measures that were put in place to control the spread of the virus during lockdown were effective and continue to be effective, except in areas where, for whatever reason, they've been more difficult to manage.
The research team is looking into a new study into those that have already had COVID-19 and what some of the long-term health issues may be for those who have overcome it.
There are 3 groups of patients who are of particular interest here. So the most obvious are those people who came to hospital, were very sick with COVID, might have ended up on ICU, have gone home, fortunately haven't recovered, but are actually left with ongoing lung scarring or muscle weakness or other symptoms. And it's quite clear there's quite a lot of long-term disease associated with having had severe COVID in at least some people. And we need to understand more about the natural history of those longer-term problems, and also to find interventions which work to relieve people of those symptoms and get them back to normal as fast as possible.
The study will also look into patients who manage coronavirus at home and those in the social care sector as well. Jake Brigstock reporting for Notts TV.